All right, Keith, thanks. Enjoy. All right, turning now to the pandemic, and soon there could be a COVID-19 vaccine for kids ages 5 to 11.
We are speaking with Dr. Rahul Gupta, a specialist in internal medicine and a division chief at St. Vincent's Medical Center, about what this could mean for kids here in Connecticut. And Dr. Gupta, thanks for joining us. I want to ask you first, from what you're hearing, how soon might we see a decision on vaccine approval for kids? And I'm asking about Moderna, Pfizer, and J&J.
Hi, Brent. Thanks for having me. So from what we know right now, obviously, all three vaccines have applied for EUA. They are actually right now in the process of collecting data from the reports from Pfizer. They are towards the end of collecting data. They believe that they should be able to, wrap up their data collection and analysis by end of September. And once all that data is collected, it's sent over to FDA, which is going to take some more time. Usually it takes months, but they have assured FDA that, they would try to do it fast, and hopefully it would not take months, but weeks. That also is congruent with the efforts of AAP, that is also pushing for rapid, data analysis and approval. But since even EUA does not cut any corners, it does take some time. And another thing that is taking a little bit longer is because all the manufacturers are trying different strengths and doses and compositions to optimize the dosing and the side effect profile of all the vaccinations. So it could be as soon as late October, or, maybe a little bit later than that. But the soonest would be end of October.
And if this does become a reality, how would this impact mask mandates and guidelines in schools? What's your opinion?
So in my opinion, vaccination and masking are kind of related, but not really. They don't go hand in hand totally. Because masking in a community depends on the community infection rate and community transmission rates, which currently are high. And going into fall, and looking at the trend, since the transmission rate in our communities is going up, I would think masking would be here to stay, even after vaccination. Just like how we've seen for adults. I think even for the kids, it's going to be here to stay. And I think it is overall a good practice anyways. I always give this example of having brakes and airbags in your car. Masks are like brakes, and vaccination is like airbags. So, we should use our brakes more often, and, hopefully never catch an infection. That's when we need the vaccination, our immunity to come in. So for now, the masks will be here, and as I said, it depends on the transmission rate, not really just the vaccination rate in a community. Now, of course, as more and more people get vaccinated, the transmission may drop off, and there might be a point when the transmission rate becomes low in a community, and at that time, there may be that would be the time when the masking may become optional.
All right, Dr. Gupta, thank you for joining us. We appreciate your expertise.
Thank you so much, Brent.